and I was spending a lot of time on my hand therapy program at home, sometimes up to 4 or 5 hours a day, just because I knew I wanted to give myself the best chance to be able to go back to the piano and to give myself the best way recovery. I know that hand therapy is as important as the surgery itself with your recovery and your outcome. So there was no way that I would not do the exercises every single day. I was meticulous of doing all of the exercises, properly, doing the scar massage 5 times a day. Yeah, in the first few months, it was easily 4 or 5 hours altogether. Contrast bathing and various different things. But we did hit a brick wall through the first 6 months. I kind of plateaued with what traditional methods were achieving for me. There was scar tissue that was building on my ring finger, and therefore that finger wouldn't flex and bend at all. So that's when Gabby started to thinking of other methods, really. Yeah, every single hand therapy session that I even still have with Gabby, she's always proactively thinking of new things that I could do. How can I fix this? How can I find a solution to this problem? Not just settling.
Did a great job. And so she reached out to me at that point because my specialty is the stiff hand and the casting motion to mobilize stiffness technique. And she presented your case to me, and the three of us met together for that first session. When you were first approached about using the Sims technique and using a non-removable cast, what was going through your mind? Did you think this is crazy, or were you thinking, okay, it makes sense?
Yeah, a bit of both. I did take some persuasion, I think, to come around to the idea of having a non-removable cast on my hand or on my whole wrist and forearm. It was, luckily for me, I don't need to drive for work. I work from home, so not being able to drive wasn't a big issue for me. Not being able to play the piano, or because at this point I had started to be able to relearn trying to play the piano and getting back into things. So to then not be able to play and to stop that progress felt like like a difficult pill to swallow, because it was stopping me. It was like going backwards with that. So that was more how I was feeling with Sims, but I understood how much it could help me. And it was like with Gabby and yourself showing me the progress that other patients had had with Sims. That was, I said, you know what, let's just go for it. Let's try it. I think the first cast that I went into was a 2 weeks non-removable. So 2 weeks is nothing for the permanent gains that the technique could have given me. So we went in and we had the Zoom calls together with yourself, Gabby, and me in the hospital. And Gabby was learning as well how to do the Sims plaster. But we went for it and we put it on, and it was heavy. And I did the 2 weeks, and I was doing the flexion exercises all the time in the cast. But to be honest, after a day or two, you get used to it, and it's not as bad as the mind thinks. Always most of the time our thoughts make things feel like they're a lot worse than what it really is in reality. So within a few days, I could see the progress as well, which makes you then feel motivated to keep going, and it was worth it. The biggest thing I noticed when I had the first Sims cast removed was the things that you can't see the progress in when it's on, which was the soft tissue. My hand just felt like a baby's skin. All of the heat from inside the plaster of Paris had been working over the 2 or 3 weeks, and all of the scarring felt really soft, and all of my skin felt like it had been massaging itself within the cast the whole time, and that was really a profound difference. So it wasn't just the exercising, but also the soft tissue benefits as well. and the way that my brain had started to bend my fingers in the correct order and pattern again. So yeah, it was eye-opening when it was removed.
Thank you for mentioning that, because that's the difference between SIMS and traditional therapy. If you have a thermoplastic splint, or if you go for massage, or if you're wearing silicone, or if you're having kinesio tape, or if you, all these little tools and tricks that we have, that none of them are on or used long enough to get that impact. And
Yeah,
only 2 weeks of just having that pseudo massage, you were able to experience that simply because you couldn't remove it.
absolutely. And yeah, and there was no effort needed. It took no time through my day. It was just on my arm. I think you told me once, it was like having a hand therapist on your arm 24/7, and it's completely true.
Yeah.
You know, it had multiple benefits. So that one was actually bivalved. So Gabby had it cut and then straps put across the side, so I could slip it on and off.
Yeah. That's great. So you were in it for 2 weeks and then bivalved, which is amazing, because with the extent of your injury, most patients have a circumferential cast for at least 3 months. You know, it can be up to 3 months. So I think you showed great progress. Why don't you just show us your hand right now, Stephen, just so everyone can have a look at your hand and just see that's the level of the amputation. And then just show us your movement. That's incredible. Tell us, show us or simulate before SIMS, how much movement did you have?
Oh, it was probably here, and it was all coming from the MCP joint here. There was barely any bend on the DIPs and PIP joints.
Yeah. You had a dominant intrinsic plus pattern of motion. So you were just using those powerful intrinsics to try and achieve that. But your ring finger was problematic. It actually lagged. So the index and middle progressed quite quickly, but the ring finger lagged.
Yeah, the ring finger wasn't responding, and I think nobody realized. We didn't really know why. We were trying to understand why SIMS was working for the two, but not so much. I mean, it did help, but it wasn't as quick as as the index and middle finger. And when we studied the X-rays, and when Gabby and the surgeons and yourselves were looking at the X-rays, it was noticed that there was some twist on the bones where they'd re-healed. So that could have been influencing that finger. But also back at the start, when Gabby was having to balance the healing of the structures in the bones with the exercises that I was set, I think what had really happened was scar tissue had tethered the extensor tendon to the bone. So I had a tenolysis surgery done in December 2023. And the tenolysis released the scar tissue from the extensor tendon and the bone. And instantly on the table, I was awake for the surgery. The surgeon passively bent the finger fully in, so it was fine. It would physically move. So that was the issue. It was scar tissue. So then after that surgery in January this year, I went back into SIMS, and I had needed no persuasion to go into SIMS from Gabby, because we knew the results that it had done in the summer of 2023. And we did the SIMS to help stop the scar tissue, to help keep the movement pattern of where the scar tissue would be trying to, again, rebuild in that finger after the surgery. And I strongly feel it's worked again. And now, from going from a finger that would barely go to bend here, is now almost in the same flexion as the other two.
It's amazing. That is just an amazing result. And I just want to...
And passively it will.
Yeah. How much sensation do you have in your hand?
I have full sensation in my hand, except for in the outside nerve of my index finger, which was the one that was severed with the blood supply, and reattached. The finger has sensation here, but it's more like a fuzzy feeling around there. But I think the nerve from this side of the finger I think those fibers have kind of taken over a little bit, especially over on my fingertip. So I have good sensation on the index fingertip. It's more just on the side and back where it feels a bit like fuzzy.
And I mean,
Otherwise, fully fine.
for a pianist, if you needing to feel those keys, so functionally, that's
Yeah.
just incredible that it was, just
Yeah, so it took the index finger took a long time to gain control at the piano again. It was a little bit clumsy at times, and there's also some tendon issue going on with that index finger where one of the pulleys was damaged, which is still ongoing. It's still there now, that problem. So with the piano, that finger did take a little bit more control, but I was determined to just keep going and get back to the piano and not let that small lack of control be a determining factor in playing the piano. I looked for the solutions to overcome it,